Welcome back, everyone. Today we'll be drawing a very simple diagram of the cubital fossa of the right upper limb. Before we begin, grab a paper, a pencil, and some colored pencils. First, let's label our lateral side and our medial side. Now let's draw a triangle representing the borders of the cubital fossa. Here we drew our base, our lateral border, and our medial border. The structure of the cubital fossa is made up of 3 lines, as seen, and the base here is a line connecting the 2 epicondyles. Here, we will draw in our lateral epicondyle and our medial epicondyle. Our lateral border is made from a muscle called the Brachioradialis muscle. The muscle forming our medial border is called the Pronator teres muscle. Now on to the contents of the cubital fossa. Inside the cubital fossa are 4 important structures. We'll start from the medial side with our first structure going down, our median nerve. Lateral to the median nerve, we'll draw in the brachial artery, along with its bifurcation. Now the brachial artery gives rise to 2 important arteries called the ulnar artery, going medially, and the radial artery, going laterally. Lateral to the brachial artery is our next structure. This is the tendon of biceps brachii. And our 4th and last structure will be most lateral as the radial nerve. So now repeat and label with me. We have the median nerve, the brachial artery. Inside, it bifurcates into the radial artery and ulnar artery. Lateral to it is the tendon of biceps brachii. And finally, most lateral is the radial nerve. Now let's just add a couple of more things for completeness. The floor of the cubital fossa is formed by the supinator muscle and the brachialis muscle. The roof of the cubital fossa is made up of skin superficially, then the fascia, and deep we can find the bicipital aponeurosis. The tendon of biceps brachii has 2 insertions. One goes towards the radius, laterally, and the other is a flattened tendon which fans out medially. Going this way, this flattened tendon is called the bicipital aponeurosis. The bicipital aponeurosis provides a little protection to these medial structures and does not associate with the radial nerve. And that's it. You successfully drew the cubital fossa. Remember the structure, the contents, and all the important extras.
Are you learning something from our videos? Well then click the subscribe button to your right. We are releasing high-yield lessons and ways for you to get ahead in class. Be sure to follow us on Instagram to take interactive quizzes and view your favorite diagrams. Nothing can stop you, but only if you believe in yourself. You got this.